大家好，歡迎大家收睇周一長談呢個節目，我哋嘅節目主持人姚永安。對於一啲低收入同埋係冇呢個牙醫保健嘅朋友呢，就今年係一個好消息俾大家嘅，因為加拿大嘅牙醫保健計劃呢，就喺今年2024年推出。咁今日我哋呢一集咧，就除咗講呢個加拿大嘅最新嘅牙醫保健之外咧，亦都會同大家講下少少關於加拿大呢個全國醫療保健究竟當年係點樣嚟嘅咧？今日好高興咧，就請你位嘉賓咧，就係新民主黨嘅衛生事務評論員，亦都係溫哥華Kingsway 區嘅國會議員 Davies。Welcome to our show。Thanks,
it's great to be with you, Gabriel.
OK， 咁我哋今日其實想講嘅咧就係牙醫保健。咁但係咧，我哋有好多觀眾咧，可能都嚟咗唔係好耐，咁起碼冇60年咁耐啦。咁就可能都唔知道究竟我哋加拿大嘅全國醫療保健係點樣嚟嘅。咁既然有你喺度啦，咁我亦都想問下你，究竟我哋嘅醫療保健點嚟啦？我記得就係話喺20年之前呢，就係CBC 就做咗一個全國嘅民意調查，就問加拿大人究竟邊一位呢？佢認為係最偉大嘅加拿大人。咁結果咧就係揀咗新民主黨嘅創黨嘅黨領就 Tommy Douglas， 因為佢從前咧就喺沙省係設立咗呢個全民醫療保健嘅。咁但係我記得咧睇翻歷史嘅時候咧，當佢當時係想開設呢個全民醫療保健嘅時候咧，係有好大嘅反對聲音，尤其是嚟自醫生嘅。當時咧以我所知係啲醫生咧係團結一齊咧係搞罷工，係罷工咗好似成個月嘅時間嘅。咁其實當時點解有咁多人會反對設立呢個全民嘅醫療保健呢
？Well, thanks, Gabriel. That's a really important question. You know, there's still Canadians who are alive today who can remember a time in Canada where you didn't get access to doctor's care or hospital care unless you paid for it. Now, of course, I think now most Canadians are very proud of the fact that we have a healthcare system where it's a right of citizenship or permanent residency. Everybody has equal access to see a doctor or go to the hospital, regardless of how much money they have, and they don't have to pay out of their own pocket. It's called universal public health care. But the idea was started really in the 1940s in one province, in Saskatchewan. Now at that time across Canada in the 1940s, there was no public health care. If you had to have a baby, you had to pay the doctor. If you broke your arm, had to go to the hospital, you had to pay. And if you couldn't pay, you didn't get the care. So Tommy Douglas was the premier of Saskatchewan. He was in a party called the Cooperative Commonwealth Federation, the CCF. That was the party before the NDP. And Tommy Douglas, he was a preacher, he was a minister, and he thought that was wrong. He thought that everybody should have access to health care, doesn't matter if you're poor or rich. So in Saskatchewan in the 1940s, he brought in a system where first people had public coverage of hospital care, and then they broadened that to have physician care. And that was the case first in the 40s. Now, at that time, as you said, there was great opposition to that from some quarters. Many doctors and insurance companies opposed that because they felt that it would take away their freedom or take away their profits. And there was a strike. Doctors went on strike. And the way Tommy Douglas got around that is he imported doctors from the UK.
Oh, wow. Okay.
To come into Saskatchewan. Mm-hmm. And he brought in doctors who believed, as he did, that making sure everybody had health care was more important than a particular profit or the wealth of a doctor. So he weathered that storm and he got it established in Saskatchewan. Now that worked so well that in the 1960s, in the early 1960s, there was a minority parliament in Ottawa. Lester Pearson was the prime minister. He had a minority Liberal government. And Tommy Douglas, by that time, in 1960, was elected the national leader of the New Democratic Party, the NDP.
At that time, he was the MP elected in Burnaby.
That's right. He He actually lost government after bringing in Medicare in Saskatchewan. And he was elected in Burnaby, so there's a BC connection to healthcare. And because of that, in the early 1960s, he said to the Liberals, if you want the support of the NDP, you have to take that idea in Saskatchewan that worked so well and make it available across Canada. So in the 1960s, for the first time in history, we had the establishment of national public health care brought in by Tommy Douglas and the NDP. And that's why I think many Canadians voted him the greatest Canadian, because the result of his work is he saved countless lives and improved the health of everybody. And not only is it a good social justice issue, because everybody has access, but it's a very cherished program that Canadians are proud of. Sets us apart from the United States, where they don't have this, and we have public health care for all regardless of your station, and that's due to the NDP and Tommy Douglas.
嗱，當時咧其實即係反對嘅聲音咧，其中一個咧就係關於擔心你如果政府咧引入呢個免費醫療咧，就會用好多錢啦，咁就會赤字㗎啦。咁但係結果咧，沙省嘅經驗咧係一路都平衡預算嘅，即係冇使達到嘅。咁同埋當年咧 ，Tommy Douglas 呢個所謂全國醫療保健咧，其實就好似唔係淨係睇醫生嘅，當時佢有個名咧叫做由頭到腳嘅。咁其實Don可唔可以同你解釋下咩叫由頭到腳嘅醫療咧？
Yeah, I'll start with a little bit on the economics of it, because Tommy Douglas in Saskatchewan brought in public health care and balanced the provincial budget 12 straight years in a row.
Yeah.
The other thing about public health care is that it's actually not only the fairest way to make sure everybody gets care, it's the most cost effective. It's the cheapest way to deliver health care. That's why if you look at the United States, they pay more money per person on health care than we do in Canada. And we cover 100% of patients and they don't. So that's one thing I wanted to just make clear, is that public health care is not only fair, it's also smart economics. Now, in terms of your question about head to toe, Tommy Douglas in Saskatchewan believed in head-to-toe healthcare. That's why in Saskatchewan they started with doctors and hospitals, but they actually had provincial dental care programs. And he wanted to expand it over time so that everything, your eyes, your ears, your mental health needs, everything would be covered by the public healthcare system. But he was limited in Saskatchewan by their revenues. Saskatchewan's not a wealthy province at the time. They didn't have a lot of oil and gas. They only were a farming community. So they were limited by money. When Tommy Douglas was elected leader of the NDP in the 1960s, he helped create something called the Hall Commission, which was the government appointed a Supreme Court Justice, Emmett Hall was his name, who studied healthcare. And his recommendation in the report was that we should have a healthcare system that covered everybody head to toe, including dental care, your teeth, eye care, auditory care, mental health care, everything. But they got started in the 1960s only on hospital care and doctor's care. And interestingly, one of the reasons they didn't start with dental care was they didn't think they had enough dentists in Canada to serve the whole population. So they decided they would start and then build later. Well, what happened? Here we are 60 years later, and we've never really gotten farther than hospital and doctor coverage. That's why this Parliament, the NDP, like Tommy Douglas did in the 60s with the Pearson government, used our power with the Trudeau government to say, let's move forward on dental care and move forward on pharmacare so that we can get prescription coverage. But the NDP believes everything should be covered under our public system. Your hearing aids, your vision care, your mental health if you need counseling, dental care, pharmaceuticals should all be covered under our public health care system. So we're trying to move forward and achieve Tommy Douglas's dream of head-to-toe coverage for the entire body.
今時今日咧就唔係牙醫就係反對設立呢個牙齒嘅保健啦，咁反而係我哋聯邦保守黨。咁我想問你，點解保守黨係會咁反對成立呢個全國嘅牙醫保健呢？
It's a good question. I think only Canadians should be asking Pierre Poilievre that question next election. What I can tell you is that the Conservative Party historically has not believed in public delivery of healthcare. They tend to want to support the private sector, and so they tend to favor a private delivery of services and private profits. That's their philosophy. I can tell you the Conservatives have voted against dental care and against pharmacare every time it's been brought up in the House of Commons.
The Liberals as well.
Liberals did as well. Yeah, we had to force them to do it this Parliament. You're absolutely right. But I think that the other thing is now we have very large profits in the insurance companies and very large profits in the pharmaceutical companies. I read recently that the wealthiest country or company in the world is a pharmaceutical company. It's the first $1 trillion company.
Oh, wow.
And so the profits are massive in pharmaceuticals and in insurance. And so I think the Conservatives, being the party of big business, are listening more to the insurance and drug industry than they are to the needs of patients. And we believe that we have to put the needs of patients first.
好啦，咁我哋講下呢個加拿大嘅牙醫保健計劃啦。咁啊，究竟呢個計劃係有啲乜嘢人係符合呢個條件係用呢個服務呢？咁同埋仲有呢，就係呢個牙醫保健服務係會包啲乜嘢，同埋個費用係點樣算法嘅呢？
Well, first I want to say at the outset, Gabriel, that the NDP believes that all dental care should be covered through our public healthcare system for everybody. That's our philosophy. But what we were only able to negotiate with Liberals was to get a start on this. We call it a down payment on universal dental care. So what the eligibility requirements are in this program is that you have to make under $90,000 of family income, and you can't have any dental insurance provided through your workplace. So it's basically it's for people who don't have dental insurance and who make under $90,000. And those are the only two requirements. You have to file a tax return. You can be a Canadian citizen or a permanent resident. And to enroll in this, we sent letters to seniors. We're starting with seniors first to enroll them in the program. So in December, seniors over 87 got a letter, and then in January it was 79 to 86 years old, and then in February it was I think it was 75 to 72 to 76, and so on. Once you hit 65, everybody will be invited to apply online. Those people could do it by phone. They get a letter in the mail, they phone the number, and they can apply. People under the age of 65 will apply online, and then they'll get a letter in the mail if they qualify, and they'll be able to get their card, their dental card, and they'll be able to go to the dentist after that. We think the first people will start going to the dentist starting in May.
加拿大嘅醫療服務咧，就係由省政府去經營去運作㗎啦。咁我哋呢個全國嘅牙醫保健究竟係邊一個去運作嘅咧？咁同埋仲有就係點樣去申請呢個服務嘅咧？
Well, it's funny. Healthcare in Canada is actually shared jurisdiction. The provinces deliver a lot of it, but the federal government does have a role to play in it as well. So this program, the Canadian Dental Care Program, is 100% funded and administered by the federal government. That's one of the reasons the provinces are okay with it, because they're not paying for it. The federal government pays 100% of the cost. Carrying on with how you apply is seniors will receive a letter in the mail, but once you hit 65, then people will be asked to apply online starting in June, May and June. Children under 18 and people with a disability will be invited to apply online. And then by the end of this year, by the end of 2024, we will start with everybody of all ages who will apply online on computer, who have the eligibility criteria under $90,000 and they don't have dental insurance. There will be phone lines set up for people that have difficulty enrolling so that they can get help, but it'll be a simple process. You basically have to go online, put your name in. You'll be asked to confirm that your income is under $90,000. You'll be asked to confirm you don't have dental insurance through your work. A few other questions, submit it, and then Sun Life, who is the processor for this program, who's been hired by the federal government, will then process the application. And if you qualify, send you a card in the mail, and you'll be invited to go to the dentist.
Yeah， 呢個其實就阿 Don 都講咗點樣申請呢樣嘢。其實就我亦都幫過一對奇英夫婦去做呢樣嘢㗎。佢哋收到呢封信，咁就我只要幫佢打個電話，咁電話咧就佢會問你嗰個醫療卡個號碼，同埋呢封信俾你一個特別嘅密碼，咁同埋問你就好似頭先所講嘅就係有冇呢個牙醫保健嘅計劃啊，現有嘅僱主嘅，如果冇嘅，你解答咗即係用呢個數字牌咧就撳落去咧，基本上就可以解答咗。咁你答晒啲問題咧，基本上就已經完成咗呢個登記嘅手續㗎啦。咁但係我亦都想問咧你一個問題咧，就係話究竟如果你係符合呢一個呢個條件，但係又收唔到信嘅，咁點辦呢？
Yeah, it's a little bit confusing because the letter went out to seniors. I think it was over the age of 70, and the letter gave them instructions to apply by phone. And the idea was that seniors over 70 were not as comfortable applying with a computer. But the idea is that under 70, people in their 60s and below, they're comfortable using a computer. So they won't be getting a letter in the mail. There'll be advertising saying that your age eligibility is now open, and you can just go. There'll be a website, and you just go on the website. You can Google it, Canada Dental Care Plan, and you can just apply online. So that's the process that's going to happen for everybody after this. But you're right, the phone system was very easy to use for those seniors that could use it.
If they know English.
That's true,
important.
yeah. Apparently there are people, I think, that are available by the federal government who can interpret and who can provide language issues. I just want to stop and say that I should have said this from the beginning. One thing that's so important is our mouths are critical to our overall health. It's silly that we cover our whole bodies in healthcare, but we cut out this piece and we say, no, we're not going to cover that. Only the tonsils back. And you know, if you have bad oral health, it can lead to cardiac problems, heart problems, diabetes complications. When seniors can't eat properly, it affects their nutrition, and then their health suffers. It even affects women's pregnancies, and it can result in low birth weight and premature birth in their children. So it's really important, we think, that we remind people that oral health care is primary health care. It's as important as any other part of your body. And that's why the NDP was so insistent that we start addressing this. And this program will result in about 9 million Canadians who don't have dental insurance now being able to go to the dentist.
當然好重要啦，就係話係有個牙醫保健咁，但係好啦，咁你真係需要睇牙嘅時候，究竟呢個全國嘅牙醫保健服務係包啲乜嘢服務嘅咧？
Well, it's basically like a standard normal dental plan. It covers everything from the beginning to the end. It covers dental exams, x-rays, your dental exam, cleanings, polishing, cleaning, fluoride treatments, all the way to filling cavities, root canals, crowns if you need them, all the way to dentures and partial plates, and even orthodontics, braces, if it's medically necessary to correct your bite. So it's basically a very normal dental plan with a very broad range of services. And the key is, in this plan is, the test is it medically necessary? Do you need it for your health? It does not cover cosmetic services. So you can't get veneers put on your teeth. You can't have braces if it's just for cosmetic reasons. So private plans sometimes cover those things, but you pay for it. This plan is medically necessary, but it has a very broad range of services.
好啦，咁我哋而家成日都聽到出邊好多時咧，保守黨都話要呢個選舉嘅。咁佢就話：而家係大家都知道杜魯多好唔受歡迎啦，咁應該嚟個選舉。咁但係加拿大嘅選舉咧係4年一度嘅，咁呢個選舉嘅日期咧應該係明年嘅10月。 但係當然即係而家喺呢個小綠黨政府啦，即係小綠黨政府可能會冧檔，或者係有其他因素會有呢個大選嘅。咁我想問你啦，嗱而家呢個加拿大牙醫保健計劃就剛剛推出啦。如果你話今年突然之間大選轉咗做保守黨執政嘅話，會唔會呢一個牙醫保健計劃又會即係夭折呢？
Well, I think that the dental plan is in great jeopardy. If there's a conservative government led by Pierre Poilievre, I think there's a very good chance they'll cancel it. Why do I say that? Because every time we brought up dental care in the House of Commons, they vote against it, or they speak against it. And to this day, Pierre Poilievre, when asked that question, whether he will keep the dental care plan, he refuses to answer. So I personally believe that the Conservatives will cancel the dental care plan if they get in power. But I think anybody would have to say that there's a very, very good chance that they would do that. They would cancel it. And I'm hoping that the plan will be in place strong enough, and there's millions of Canadians that have it, that no government should touch it in the future. I mean, think how many seniors are going to get dental care. How many seniors make under $90,000 a year and don't have dental insurance? I'll tell you, most of them. Most seniors have that. And so, you know, I think it's heartless and bad healthcare policy and bad economic policy for any government to take away dental care from a population like that. It keeps them out of the hospital. It keeps them healthier. But given the track record of the Conservatives, I greatly fear that they would cancel it.
OK. 咁我哋而家亦都要講下呢個藥物保健計劃，因為新民主黨支持自由黨呢個小綠黨政府咧，就除咗話呢個牙齒保健之外咧，仲有呢個藥物保健計劃嘅。咁最近我亦都睇到新聞咧，就係你哋個黨個黨領祖面成咧，就喺媒體度公開講啦，就俾杜魯多一個最後嘅限期，就話如果佢唔喺3月1號之前咧，就係推出呢一個藥物保健嘅法案咧，咁就新民主黨唔會繼續再支持自由黨執政㗎啦。咁你可唔可以講下而家呢個所謂藥物保健計劃嘅狀況係點樣咧
？Well, Gabriel, like dental care, the NDP believes that every Canadian should be able to get the medication that their doctors or their pharmacists or their nurse practitioners prescribe through our public healthcare system. We know that there's millions of Canadians that don't fill their prescriptions because they can't afford them. We think that's wrong. And so we have made it a condition of our support of Liberals that we at least start the process of starting to bring pharmaceuticals into the public healthcare system. So again, what we want, if there was an NDP government, we would bring all of the pharmaceuticals into the public healthcare system immediately. But with the Liberals, they don't want to do it right away. So we're working on doing it in steps. So as we're talking right now, I've been negotiating with Mark Holland, the Minister of Health, and we are very close to having an agreement to move towards that. And this kind of system that we want, the NDP is staying firm that we don't want any kind of income test like in dental care. We want every Canadian to be able to get the prescription drugs they need through our public healthcare system. We said we'd be flexible in moving towards that in steps. So what we're doing is we're starting with several classes of drugs that will be moved into the public healthcare system. The Liberals still don't believe that pharmacare will work. There's been 7 different studies done on pharmacare that says if we bring pharmaceuticals into the public healthcare system, we will save money as a country, billions of dollars. The NDP believes that, the NDP or the Liberals are not convinced. So that's why we think we're going to start with some drug categories, get it established to prove that when you can give everybody in Canada their pharmaceuticals and you can get savings by things like bulk buying. Imagine the Canadian government buying a pharmaceutical class for 40 million Canadians. You get savings, 40% actually, you save on drugs if the federal government can use its bargaining power to drive down the price of drugs, as an example. So we're that close to coming to an agreement. By the time your viewers see this, there may be one. I hope so. And I hope we continue to make progress, and we're working to the day when every Canadian citizen can walk into a pharmacy, hand their prescription over to the pharmacist, and get the medication they need, and it's paid for through our public system, just like they do when they walk in a hospital. That's what we're working towards, and we're going to make we hope, the NDP hopes, will make a significant step towards that this year.
Yeah, I think Canada is the only Western country who has a national health care that doesn't have the pharmacare program with it. So that's something people need to know. And you mentioned about studies. Among all those studies, what is the cost of implementing a national dental care and pharmacare program?
Well, with dental care, we've put in the budget. We're going to spend. It's pegged at about $4.5 billion a year. Now, to put that in perspective, last year in Canada, we spent from all sources $360 billion on healthcare. So if you think you're adding $4.5 billion to $360 billion, that's a fraction of 1%, and that will cover 9 million Canadians' dental care. Pharmacare, the costing is much more interesting. Every study has shown that if you take the system we have now, the private-public patchwork, and you take all of that and put it into our public system, we will save somewhere between $4 and $11 billion a year. So I don't ask what it'll cost us. The question is what will it save us to bring in public pharmacare? And again, I touched on why that is. If you bring that into the public system, I've already talked about the savings on bulk buying. It's like, you know that if you go to Costco or Superstore, the price for your toilet paper is cheaper than if you go to a local corner store because of the volume. But there's also streamlined administration. Right now in Canada, there's 100,000 extended healthcare plans in this country. If you eliminated those and you processed the claims through a single system in every province and territory, you get that down to 13. So you save on administration, you save on bulk buying, you save on profits. You take the profits out of the insurance companies because they make money when they process your claim. So right off the bat, you got probably a 10-15% savings by processing the claims through your public system where you don't have to pay profit on it. And then last, it's estimated that we will save several $billions a year by making sure people get their medicine. An example is a person with diabetes. If you have diabetes and you don't take your insulin, and you end up in the hospital in intensive care once, the amount of money our system will spend on that one time you're in the hospital in intensive care is more money than it would cost than to give you free insulin for life. So when you keep people healthier by getting them their medication, you prevent them from getting sicker and having more expensive care down the road. So that's another savings right there. So when you wrap all that up together, national pharmacare has been estimated time and time again by the Parliamentary Budget Officer, by the Romano Commission, by the Health Committee in Parliament, by the Hoskins Advisory Council, who Prime Minister Trudeau appointed to look at this. Those are just in the last 15 years. 4 different studies has shown that when we bring in national pharmacare, we'll save at least $4 billion a year. So it's not only good for health, but frankly, it's an economically smart move to make. You know, I just want to say quickly, pharmaceuticals is the single fastest growing item in our entire healthcare system. We spend today more on drugs in this country, pharmaceutical drugs, than on doctors.
Oh, wow.
And it's rising faster than the rate of inflation. So if we don't do something to get control of these costs and to make sure patients get their care, then we face a catastrophic problem 10, 20, 30 years down the road. So pharmacare is not only good for healthcare, but I think it's vital that we get started on it from a financial point of view.
Okay, thanks for your explanation. 好啦，咁啊，其實咧，即係講起政府究竟點樣使錢咧，咁啊，當頭先都講過就係話，究竟係有啲咩費用係會即係推行呢啲計劃啦。但係亦都可以同你講下最近有個新聞咧，就係保守黨嘅黨領 Poilievre 咧，就係話佢係如果執政咧，就會將加拿大嘅軍費咧，就由而家嘅1.38% 嘅水平咧，增加到2% 嘅 GDP 嘅。咁即係點解咧？即係話如果佢咁樣做法咧，就每年咧政府就要用多200億20個 billion 嘅錢咧，就喺呢個軍事開支上邊嘅。咁啊，如果你話講加拿大嘅軍費，雖然係話即係比呢個北約個2% 係少，但係咧如果以國家嘅軍費嘅費用個金額嚟計咧，其實加拿大係全世界排第14嘅。我哋所用嘅軍費咧竟然係比以色列同埋波蘭咧係仲更加多嘅。咁所以去到底就係話，究竟個政府點樣使錢？究竟啲錢係想用喺呢個買軍火上邊啦，又話用喺一啲人民可以享受嘅福利上邊咧？咁呢個其實就大家點解關心時事咧，就要睇呢啲議題㗎啦。今日時間到呢度，下個禮拜另一個話題同大家繼續傾，拜拜。